Hello, once more. I'm here again, Dr. Wan. I'm here to talk about diabetes, as I promised in my first video, a solution to your problem. So, if you are suffering from type 2 diabetes, I will say don't get worried. If you are taking your metformin, please remember to take your metformin with food, because taking that medication without food, you risk damaging your stomach, and also the stomach lining itself suffer from from the side effect of that medication. So I will strongly recommend you to keep taking your medication as your doctor advised you. And now I'm gonna propose to you people a supplement, or what we call glucose switch. So the title for this video is Supplements for Diabetes Type 2, or another name could be Glucose Switch. So essentially, it is made up of what we call beta taste. So why this beta taste? It is very important because your pancreas has the islet of Langerhans. That islet of Langerhans is where insulin is being produced. So the cells there are kind of sensitive. So something has to be done in order to make it more efficient. Remember that type 2 diabetes, there's an issue of insulin resistance. And having insulin resistance, that pancreas is engulfed in fatty tissues for most of the cases. I will say 80% of patients suffer from that condition. So something has to be done, either to dissolve that fat around the islet of Langerhans, or stimulate those cells in order for them to produce enough insulin. So that's what I'm here to do. So if you are taking your metformin and the blood sugar value is not what you expect, that is, it is still spiking, please don't panic. You could increase the dose of your metformin. It could be moving from 500 milligrams twice a day to 850 milligrams twice or even 3 times a day. Or you move to 1000 milligrams twice a day. And also do not forget to add my glucose switch or my supplement. What is this supplement made up of? It's quite simple. You could equally do it yourself. You don't really need to go far away to look for it. You don't really need to go to America to go and get it. Just look around you and get it for yourself. Those who want to buy it, of course, you can go to shops and buy the supplements, and that will be fine. So there are 3 things here. So the first one is bitter leaf. There are 2 types of bitter leaf. The sweet one, I will say no, no, no. The bitter one, yes, that's what you need. So you have the bitter leaf. You have the bitter color. That's another key thing here. So, and then any other thing, say, similar to aloe vera. So if you could have these 3 components in this glucose switch, then that's fine. So, and how do you prepare it? It's simple. You get all this stuff, put them in a blender, and switch on that blender, and it transforms everything from leafy into liquid form. When it's transformed into liquid form, great. You now put it on bottle or kind of container that you could clock them and keep them in the fridge. And make sure that you take them 3 times a day. So here it could be a small glass of it, or I would call it 3 to 5 spoonful. And whenever you want to take it, say in the morning, you get 3 to 5 spoonful. By midday, 3 to 5 spoonful, and in the evening before going to bed, 3 to 5 spoons. That's, I'm referring to tablespoon, not teaspoon. So that is what you need. And believe me, like it or not, within a couple of weeks, you should see for yourself that things are going well. I know some will find it challenging because of the taste, but again, the more the taste bitter, the more efficient your smoothie will be. So that smoothie contains what we call tannic acid. That tannic acid has an astringent effect at the level of the islets of Langerhans. So the islets of Langerhans, they contain billions of cells. So those billions of cells now, when they come in contact with the tannic acid from your bitter stuff, it creates what we call an astringent reaction. That astringent reaction is what stimulates now your pancreas. So it increases the output, because the whole trouble here kicks in only when the output drops at the level of your pancreas. That the islets of Langerhans are not able to sufficiently supply your body with insulin. And if that is ongoing, the blood sugar value now spikes instead of plummeting. So that's my best advice for you. If you don't want to suffer from any spillover, any issue with diabetes, which is hard to manage, then this is what you have to do. So my supplement has nothing to do with your therapy. That it doesn't stop it. Instead, it goes in improving what you are taking. So it's kind of an adjuvant or an adjunct, an add-on to what your doctor has already prescribed for you. So please don't panic. Don't say, hey, Dr. Wang has said I should stop taking medication for diabetes and use but his smoothies. No, no, no. Take the medication prescribed for you by your doctor and add on what I'm saying here. So my smoothie or my supplement will go a long way in improving on your medical condition. Again, I'm more than happy to repeat it here, how to prepare it. You get your bitter color, aloe vera, bitter leaf, any other thing that you find it that has that bitter taste, and put it in a blender, blend it, put it now into smaller containers like bottle. Close them, keep them in the fridge, and make sure take them 3 times a day: morning, midday, and before going to bed. And dosaging should be 3 to 5 spoonfuls. And the type of spoon here should be tablespoon and not teaspoon. So that's my message for you. Make sure you do this at the comfort of your home. You don't really need to go to any shop to buy them. If you want to buy them already prepared, good for you. But I'm just trying to make life easier for you people. I know times are hard and I want to see you happy. That's why I'm offering this video for you. I love you all. Once more, do not forget to subscribe, love my video, and share it with loved ones. Once more, I'm Dr. Wan and I'm here to help you. Thank you and have a wonderful evening. Ciao.